Hi, my name's Marsha McAdam, and I'm an expert by experience with the Equally Well collaboration. On the 12th of March, it was to be the first year celebration. However, due to the corona outbreak, this was postponed, and at the time, I was really upset because I didn't realise just how it was going to change people's lives, and I had wanted to come along and celebrate the first year anniversary of the Equally Well campaign, because I felt that it had all the key stakeholders round the table, and at the time I don't think anyone realised just how life would change. So on the day for the celebration, I was due to be on a panel discussion at the end of the day to talk about how we'd like things to change by 2030. And one of the things I was going to talk about was the ghrelin, which is known as the hunger hormone. Now, I heard about this at a conference a few years ago. So the ghrelin is a hormone produced in the gut. It's often termed as the hunger hormone and sometimes called melamorlin. It travels through your bloodstream and to your brain, where it tells your brain to become hungry and seek out food. It also affects your wake, sleep cycle, reward-seeking behavior, taste sensation, and carbohydrate metabolism. This hormone is produced in your stomach and secreted when your stomach is empty. It enters the bloodstream and affects a part of the brain known as hypothalamus, which governs your hormones and appetite. The higher your levels, the hungrier you get. The lower levels, the more full you feel, and easier it is to eat fewer calories. So when I heard this quite a few years ago at a conference, I was like, I remember putting my hand up and saying, it validates exactly about my eating disorder. For years, I was actually eating the whole time to actually try and fill up that emptiness inside of me. And unfortunately, I became very, very overweight and then developed non-alcoholic fatty liver disease, type 2 diabetes, and the list goes on. And I just wish that years ago I'd been told about this hormone, and so I want to make sure that GPs and psychiatrists going forward, actually, just as you're about to issue the prescription, have this conversation with your patients. It is so worrying. I mean, I've unfortunately developed an eating disorder, and I use food as a way of controlling things. I now more than ever, through this time of uncertainty, and also the fear, my sugar intake has increased so much, which then increases my blood sugars, and the cycle goes on and on. So I hope that through listening to this video that you can actually think about what I've mentioned, and starting having conversations when you can with the mental health and physical health professionals. Take care and keep safe, everyone. Thank you.